here we go. Good morning. We're going to start in just a couple of seconds. We're going to give our media partners a few seconds to jump in on this. Okay, good morning and thank you for joining us for our Monday COVID-19 news conference. Today we'll be covering the latest information from over the weekend, how our local first responders respond to corona-related issues, and an in-depth look at testing here in Lubbock. And our panelists this morning are Director of Public Health, Catherine Wells, Local Health Authority, Dr. Ron Cook, Lubbock Fire Chief Sean Fogerson, and Lubbock Mayor Dan Pope. Let's start with Catherine Wells.
Good morning, and thank you for allowing me to update our residents on the current COVID-19 situation here in Lubbock. Before I begin this update, I want to again assure our residents that the health department is working with our hospitals, doctors, healthcare providers, as well as state health officials to ensure everyone has the most recent information and guidance as we continue to move forward with this outbreak. With this in mind, we want the public to continue to stay at home. This is working. We are seeing our numbers level off. We want people to follow good hygiene practices. And when you must be out, make sure you practice social distancing. And now we also want to see when everybody's out there to be wearing some sort of facial covering. Today, I'm going to update you quickly on our current COVID-19 cases. We are reporting as of yesterday, 430 reported cases in Lubbock. I also regret that today we are also reporting 32 deaths. The majority of these deaths are related to our nursing homes, and that's because these individuals are at the greatest risk for severe medical complications if they are to become infected. We are also now reporting that we have 107 people who are fully recovered. And there are two ways the health department determines somebody's recovered. The first method is the test-based method. This means that the individual has 2 negative COVID-19 tests that are at least 24 hours apart. This is recommended for our hospitalized patients, patients in nursing homes. This is not the recommended method for the general public. The recommended method for the general public is watching for symptoms. And we want to see an individual that has been, it's been at least 7 days since they became symptomatic. Plus, we want to make sure that they've had no symptoms for at least 3 days or 72 hours. So we're looking for no fever, no cough, no other symptoms, and not taking any medications to keep them from getting those symptoms. Once we see that, the health department considers that individual to be recovered, and they don't need to go in for that second test. At this time, that concludes our update from the health department, and I'll now turn it over to Dr. Cook. Thanks.
Thank you, Catherine. I appreciate that. You know, let me just give Catherine and her department a pat on the back for all the hard work that they've done in chasing down all these leads and all our infected individuals and making sure that everybody's doing okay. Let me remind everybody, just like Catherine said, we got to wash your hands, cover your cough, stay at home if you're ill, and make sure that you don't give that virus legs. Remember I said virus ain't got no legs unless they use your legs to get to somebody else. And you may be asymptomatic without symptoms, and you could carry that virus to somebody that you love and care for that may not do as well with that virus as you might be. And so as a result, they could get ill, significantly ill. So don't give those virus any legs to get someplace else. Make sure that you continue your social distancing, and then also wear your mask, your facial covering, please. I was out some this weekend. It was a beautiful weekend, and I saw most people wearing facial masks or facial coverings when they are out. Some of you need some re-encouragement to try to make sure that you do that. So please wear those because we don't want you spreading the virus. The other thing I want to talk to you about, since today we're kind of focusing on testing. So in Lubbock, we have two types of tests. The first test is called a PCR test. PCR stands for polymerase chain reaction. This is that test that when you go to the drive-through or the office, they put the nasal swab in your nose, run it around, make your eyes water a little bit, and then they take it. And then in most of our tests here in Lubbock are sent off to a lab in Austin. And it takes 48 hours or so for that test to get back. What they do then at that test, that PCR test, is just a tiny amount of virus particles are on that swab. In order for us to even find those virus particles, we do this polymerase chain reaction. And that actually creates millions of copies, literally millions of copies of that virus particle. We then attach a little tag or a little light bulb on it. So after 1 million of those show up, then the machine can actually detect those little light bulbs or tags, we call them. So the machine can say whether or not you have it or you don't have it. So this test is either positive or negative. There's not really a gray zone here. So this one's positive or negative. That's called the PCR test. Now, the other test that we have here in Lubbock, it's brand new. It's called the antibody test. And the antibody test, so what is an antibody? An antibody is a little protein warrior. We'll call it a protein warrior. So when you get exposed to this virus, your body's immune system goes into full force trying to fight this infection. And one of the ways that it does this is make antibodies. And these little antibodies are protein warriors. They help fight off the infection. They also may have memory. So if you see it again, it fights off the infection so you don't get infected again or that you don't get sick again. And so this is where we're using this convalescent serum. So we use this test to make sure people are recovered from the virus. Now, we don't have to have this test, but sometimes we need this test to show that you've had the virus or that you've recovered from the virus. And that test is called the antibody test. So we have two types of tests in Lubbock. The one for the acutely ill, or that you think you've been exposed and they're symptomatic, that's called the PCR test. And the recovery test is called the antibody test. Those are the two types of tests we have in Lubbock. They're not foolproof, they're not perfect. They all have their flaws, they all have their good things about them. So we have to use them in combination sometimes to make sure everybody is recovered. So those are the two types of tests. That's all that I have today. And please make sure you wear your facial coverings when you're out, keep your social distancing, wash your hands, and virus ain't got legs. That's all that I have. Back to you, Lacey.
Thank you, Dr. Cook. And now for information on the role of Lubbock's first responders during the pandemic is Lubbock Fire Chief Sean Fogerson.
Good morning. I'm going to go over a little bit what Lubbock Fire Rescue is doing to flatten the curve and to protect you and ourselves as first responders. Our goal during emergency medical calls is to only expose the amount of personnel necessary to provide appropriate emergency medical care. I'm going to go into a little bit how we do that and what that looks like. The response begins with EMS dispatch. They go down a list of COVID-related questions so they can pass the information on to first responders on whether someone we're responding to may have COVID-19. When we respond to these medical calls, we are using a 1 in, 3 out approach, front porch assessments, and social distancing to limit exposure. And of course, we use full PPE or personal protective equipment on all medical calls and every fire call as well. For our personal protective equipment, we're using SCBA or self-contained breathing apparatus, full face piece masks with HEPA filter cartridges. That provides the highest level of respiratory protection for our first responders. Also, they are reusable. We can disinfect those after every call and use them again and again. And what that does, it saves masks for our hospital and nursing home partners so that they can use those. We also use gowns, coveralls, and of course gloves on every call. Even on fire calls, we are using social distancing. We assume that everyone we come in contact with may be infected. That keeps us from being exposed to the disease and maybe getting infected and then passing it on as asymptomatic people. Around the station, we enhanced our refresher training for infection control in February to be COVID specific. We train constantly on our infection control program because we run into pathogens through the course of our daily business all the time. We change that training to be a little more COVID specific. So the techniques that we're using are not new to us, and the concepts, we train on those on a daily basis, really. We also have an internal website that keeps our personnel up to date on all the changes that have happened throughout this emergency. And it also keeps them up to date on the emerging best practices as it relates to COVID across the country. Now, over a month ago, unfortunately, we instituted a no visitors policy at fire stations. That one really hurt us because we like to be a connected fire department. We like to be connected to our community. And part of that is letting people come in with their families, tour the fire station, look at fire trucks, and learn a little bit about fire safety. We've temporarily halted that, and we can't wait to get it started back up when all this is over. We're doing temperature checks and symptom questionnaires at the station for our personnel 3 times every shift. So when our personnel show up to work, their temperature is taken and they go through a questionnaire that talks about or asks about symptoms they might be having. And if they have a fever, or if they feel like through the questionnaire that they may have been exposed or that they may begin to feel symptoms, then we go ahead and send them home right then. Then they get their temperature checked about halfway through the shift at about the 12-hour mark. And then at the end of the shift, so we can make sure we're not sending them home with the infection to spread to their families. We require that our firefighters stay home if they are sick or even if they don't feel well. We feel that's the best way to keep them from bringing it to the station and us becoming asymptomatic carriers. We have an enhanced cleaning schedule around the station. All high-touch surfaces in the station are cleaned several times a shift with a SARS-CoV-2 approved germicidal. And we are also fumigating the interior of our fire trucks after every call, especially one that we think we may have been in contact with someone infected. And that keeps us from bringing it back to the station. We're in constant collaboration with fire and EMS services around the country to make sure that we're keeping abreast of best practices and finding out the little tricks and methods that they're learning in their response, so we can adapt those to our operations, and we're also sharing information with them. We're working hand in hand with the Lubbock Police Department to be sure that they're educated on the medical aspects of it, so that they stay safe. And we're also sharing equipment with them and make sure they have the proper equipment and know how to use it. That's all I have for today. Now I'd like to introduce Mayor Dan Pope.
Good morning. Thank you, Chief. Thanks for sharing with us that update. I appreciate you and Chief Mitchell and your leadership and what you mean to our community. And thanks for keeping the men and women of Lubbock Fire and Rescue safe so they can respond when we very most need them. I want to talk about testing. I want to continue the theme, and let me relay a few facts to you. First of all, we're very fortunate in Lubbock to have robust testing. And I'm thankful for UMC and Covenant for their drive through clinics. That's very much a big part of the why. We're still, in Lubbock County, we're testing at twice the rate of the rest of the state. Now, our positive rates are still a little bit lower than the rest of the state, as is our hospitalization rate. As of yesterday, we had tested 4,727 residents in Lubbock County testing. That grew 45%. Total tests grew 45% last week alone. There's more good news coming. Beginning today, Covenant is doing testing at their clinics and at their regional hospitals. And on Friday of this week, in a partnership with Walmart, we're glad to announce that they will open a third drive-through testing location at their store at 114th and Quaker. Now, this is in conjunction with the county and the city, and we're working with Walmart to provide for this. They want to focus on first responders. So any first responder or healthcare professional can be tested here, as well as a citizen who feels like they need to be tested because they are symptomatic or may have been exposed. There's more details to come on that this week, including an online sign up, but we're thankful for Walmart reaching out to us through Representative John Frullo, and we're thankful to be able to have more testing. Let me talk about cost real quick. We want to make certain that no citizen is not tested. Let me back up and say that simpler. We want you to be tested. If you don't have insurance, call the health department at 775-2933 and let us get you set up to be tested. The drive-through clinics are accepting insurance, and that seems to be working pretty well. However, if you've been tested and you've gotten a bill and you don't feel like you have the ability to pay that bill, call us. Call us at 775-2933 and let us work on that bill. Some of the emergency funding from the federal government will allow us to help you take care of that payment. Okay, so with all this testing, let's talk about data real quick as I wrap up. Expect more detailed demographic data from us this week. That should include zip code data as to where the positive tests are, as well as more information about race. Here's the three pieces of data that we are looking at. We're closely following the number of hospitalized. We feel good about that number, by the way. It's remained very steady. We're also looking at the number of active cases we have. And finally, we're looking at the number of new cases on a daily basis. I want to wrap by, much like Ms. Wells and Dr. Cook, reminding our citizens that we are under a stay home, stay safe order, both at a local level and at the state level. So when you're not out for essential services or essential retail, please stay home and stay safe. We see light at the end of the tunnel. We are still in the tunnel, but that light is getting a bit brighter. We can recover and do so safely. Remember the big three: wash your hands, don't touch your face, keep your distance. It's a great day in Lubbock, Texas. And that wraps me up. Back to you, Lacey.
Thank you, Mayor. And now we're going to open it up for media questions. Each organization can ask one question and one follow-up question. And here's the order for today: Daily Toreador, KMAC, KCBD, Latino Lubbock, El Editor, KOBK, Texas Tech Public Media, Fox 34, and the Avalanche Journal. So we'll start with Adon Rubio from the Daily Toreador. Adon?
Can you hear me now?
Yes.
Okay. Hello, everyone. I guess my first question is in regards to Governor Abbott's opening business and his executive order about that. And really, one of the first phases he mentioned was starting with retail and implementing retail to go. So I was just wondering how that will look at a Lubbock standpoint.
Yeah, Don, let me answer that question. We're glad the governor caught up with us. We've been in a what we've called curbside retail from day one. Our non-essential retail was never closed in that regard. We've encouraged them to do business online via the phone and delivering at curbside or delivering to a customer's home.
Now let's go to Matthew Stell.
Hey, good morning, everybody. Thanks, Lacey. My first question, this is probably for Ms. Wells. Catherine, for a moment, just kind of give us an update on Whisperwood. We know that most of the deaths were associated with Whisperwood. Now we're at 32. Are there any other deaths from other nursing homes, or is that the one where most of them are currently being associated with right now?
The majority of the deaths are associated with the Whisperwood facility. We continue to work with Texas Health and Human Services. I've consulted with the CDC on what we can do to better assist that facility to limit the transmission to any new patients. This disease really affects the elderly the most, and our goal is just to keep those people as safe as possible.
And I've got a quick follow-up, Lacey, for Mayor Pope. Mayor, we saw, excuse me, you were at the mock funeral procession for small businesses on Saturday. Tell us about the conversations you had with those folks out there, because they're asking you, hey, Mayor Pope, we understand we've got to social distance, we've got to follow the CDC guidelines, but just give us a chance to open up because we are better prepared and we can conduct better safety measures than some of the big box stores. So kind of tell us about the conversations that were had, because we know you're a pro-business guy.
I appreciate the question, Matthew. I first of all, there weren't a lot of conversations because everyone stayed in their car and practiced good social distancing. But here's my position. I'm a small business person myself. I want to get our small businesses open to customers coming in their door as soon as possible. And so when they invited me to be part of that event, the parade on Saturday, I said yes, and I was glad to be able to join them. We've got to get our retail businesses open. We're going to do that as quickly as possible while balancing the safety of our citizens. And that's my commitment. It's been my commitment all along. Thanks for the question.
Thank you.
Okay, and now we have Karen McKay from KCBD.
Good morning, Mayor. My question is for you. I think hairstylists and barbers are a real concern among the small business group, and many have asked us, many have said, would you allow one-on-one visits where they come to people's homes, or one person at a time goes into a salon during this period? Would you allow that?
Karen, it's not, thanks for the question. It's not allowable under the order that's in place today. I'm getting some feedback. It's not in place under the order that's in place it's not allowable under the order in place today. It's certainly something that we're considering. We're in conversations both locally. Our task force will look at that today in their first meeting. It's also part of the discussions we're having with members of the governor's strike force as we talk about sensibly and reasonably reopening Lubbock in Texas.
And then so far, have you had any fines, issued any fines, or has there been any disciplinary action over some people or businesses that have not complied?
I don't know exactly what those numbers are. I know there have been some tickets that have been written. I think that we're very fortunate, Karen. The vast majority of our businesses have gone along with the governor's order, our order. As much as they don't like it, they've been respectful. And I think when they're respectful, they're not only protecting themselves and their employees, but they protect our community.
Okay, and our next question is from Christy Martinez Garcia.
Good afternoon, everybody. I'm Christy with Latino Lubbock magazine. And my question is, or first, let me say this. The Reyna family lost their mother to COVID-19, and 6 days later, they lost their father and are in mourning. So this question is directed to the mayor. Ethically, do you believe that you compromised the public trust by participating in this recent funeral mock?
No, I don't. I mourn with the Reyna family and all the families that have lost loved ones in this COVID-19 situation. The parade, the small business parade on Saturday, I think was very respectful. It was done in an appropriate way, and I think in no way was it an ethical breach. I'll end like I started. I mourn with the Reyna family and all other families in Lubbock and around the state that have lost loved ones.
My next question is, for a couple of weeks, we've heard local to national figures encouraging mask wearing and social distancing. The governor of Texas also said that part of the state park reopening requires mask wearing and social distancing, that is. In Lubbock, is there truly a way to enforce mask wearing or social distancing? I mean, we're not really seeing that as much as we'd like to. What are your thoughts?
Is your question, is there a way to enforce it?
Well, yeah, is there a way
Is it a policy question about whether we should require them or how we would enforce it?
How would we enforce it, that is?
I guess would largely be, we would expect our citizens to comply. I don't think we have enough people to walk around and create a nanny state where we see if Joe or Jill are wearing their mask. I think we've encouraged people to wear face coverings. I think that's still our message. You heard Dr. Cook talk about it. You heard Ms. Wells talk about it. We've not mandated that. We're going to have an emergency council meeting on Wednesday. It could be something we discuss. I frankly think the best way to do it is for each of us personally, when we go into those locations where we're around other people, we leave our safe zone. I think a face covering is not a bad idea. And I think we should take all precaution we feel necessary.
Okay, our next question is Olga Aguero. Well, I think I lost her. Nope, there she is. Olga?
Can you hear me?
Yes.
Okay. Good morning, everybody. This is Olga Agüero with El Editor. Testing, I'm going to stay with the theme like the mayor wants to do it. On the antibiotic, Dr. Cook, can you get the virus after being an antibiotic warrior? And then why do they give a second test for a virus if you had been in the hospital, but not if you were not in the hospital? What's the difference?
Ron, you're muted.
My apologies, Olga. It's an antibody, not an antibiotic. The antibody is the little protein warrior that your body makes as a result of infection. And so we're not testing those on everybody, but we think most everybody in a normal response to an infection, we develop these antibodies. And that's what we're testing for right now, mainly frontline healthcare workers that are going back, that we need to put back in the front lines immediately as soon as they're safe to go back into the front line. Now, to answer the question about why we do that versus 2 negative tests for somebody that's going to, for most cases, some of those people are going to nursing homes or long-term care assisted facilities or those sorts of things. And we just want to make sure that they're absolutely as safe as they can be before we put them in an environment that may be very high risk, that may expose other individuals that have not been sick in an environment. So we want to make sure that they're okay to go to that environment. Did I answer your question, Olga?
Yeah, more or less. Thank you, Dr. Cook.
Okay.
I just want to say a shout out to my aunt, 85 years old, and we had a little parade this weekend too, and we stayed our distance. And I just want to say happy birthday. That made her very happy. She turned 85.
Congratulations. Tell her congratulations on her 85th birthday.
Fantastic.
From all of us.
Yeah. Lacey, you're muted.
Sorry. Our next question will be from Terry Furman from KOBK.
Good morning, everyone. I wanted to ask about the fact that the AP is showing that Lubbock County has more cases per 100,000 people than Dallas does. Can we talk about, are we seeing more negatives because we're seeing less people being tested, or are we seeing more negatives because more people are testing negative?
Catherine, you want to take that one?
Terry, I probably need a little clarification. We're testing a lot of individuals here in the community. So you were asking, can you clarify?
Well, I just wanted to clarify that the AP map, the Associated Press map, is showing that Dallas County is seeing like 98 cases per 100,000 people, where Lubbock is seeing 150 per 100,000 people. Are we getting to the point to where like we're concerned with this, or so are we testing more people and getting more negatives, or are we just getting more negatives because we're not testing as many people? Maybe that clarifies it.
And I haven't seen the AP report to give you a really look at what data they're using and analyzing. I just know we're doing our best to get individuals tested here. The health department's going to support that testing costs for our uninsured. And we just really want to find out the disease burden in our community so we can get everybody, get things open again.
Next question will be Jonathan Seaborn from Texas Tech Public Media.
Good morning. So as we start to discuss how and when to relax restrictions, there's been a lot of concern about whether or not Lubbock has hit its peak. And so I'm curious if there's been an updated estimate on when we might see our peak number of cases, and if there's any concern about a resurgence in cases from the Easter weekend.
Dr. Cook, we want to speak to that one?
I can talk to that about that a little bit. The surge number is it looks like we're below what we've predicted, which is wonderful news for all the citizens of Lubbock, and I appreciate everybody doing their part. My fear is that we get numb to that fact and that we relax our efforts. But the models that other cities have used not very applicable for those of us out here in West Texas, which is hard. We're stuck between a rock and a hard place. We want to be ready, and we are ready for the surge. We certainly don't want to get caught in not being prepared. But the models that show, they're hard to predict for our population density and all the other factors that go along with it. Most of our cases, at least initially, were associated with a nursing home here. And we've done a great job of trying to protect those individuals. And hopefully, if we can continue to protect those individuals, the others won't be so bad. But the models are not very predictive of what Lubbock is out here in our community. And that's the hard part. But what we don't want to happen is to relax so much that all of a sudden we take off again. And we have contingency plans that we're working on in case that happens. And so we don't want to take a step backwards. So let's continue to push forward with what we're doing. We're doing a good job. But we just really need to pay attention to that and not let our guard down too much.
And Jonathan, I would add to that testing remains important even after we begin to reopen. It allows us to identify places where there might be a flare-up and rapidly address that, like we've been able to do in a number of businesses where we've seen a case, and with working with the business, we've been able to clean and make sure that the right protocols are in place to safely reopen and to for it not to be dangerous for their employees or their customers.
Next
Thank you.
question is from Blair Sable from Fox 34 News.
Hi, all. So my first question is going to be for Mr. Mayor Dan Pope. So you mentioned that there is a third drive-through testing site that'll possibly be opening up very soon, which is great to hear. That will be in conjunction with Walmart. So do you have any idea when that will possibly be opened? Any timeline for that?
We expect it to open on Friday of this week.
Friday. Okay. Excellent. Thank you so much. Love to hear that we're continuing to ramp up testing, even though, you know, we might, again, feel a little numb to the numbers that we have. And then I'm not sure who could answer this question, this follow-up question that I have, because we don't have a representative from Covenant or UMC. But with the governor's plan to reopen the state, he said that he would like elective surgeries and elective procedures to come back. Do we see that also taking place at Covenant and UMC, because they also had cut back on those elective procedures before the governor had stepped in?
I don't think we're privy to that information. We would support them, any decision they make. We feel like they've been good partners, but you'd have to ask them that directly.
Okay, and our final question is from Matt Dautre from the Lubbock Avalanche Journal.
Hey everyone. I guess keeping it with the testing theme, Dr. Cook, I think we've all kind of been waiting for testing to catch up to where we want it to be. Can you just talk a bit about some of the holdups that have been taking place, kind of, you know, why it's just been slowly building to mass testing?
Right. Well, even with Walmart opening, we're not quite to mass testing as we should. It does give us the opportunity to go into areas where, like the Mayor Pope said, to those hot spots. And then what you do is you find the hot spot and you test all around that hot spot to stop, to ebb that flow of disease. And so that's the purpose. Now, some of it's been not the swabs. It was the viral transport media that you have to send it into Austin. And then we had plenty of viral transport media, and then we ran out of swabs. And so it's been just, you know, in larger cities, got first dibs, because even though our catchment area is huge in West Texas, we weren't considered first line for some of the stuff to come out. So Houston and Dallas and some of those big, huge cities, metroplexes, were first in line because of the number of individuals. That's the way it was. And now as availability of the testing supplies and test kits and everything that's involved in testing, as it become more available, then we have better access. Again, pat the citizens of Lubbock for keeping everything at bay until we can actually get more testing. You guys have done a great job. We got work to do, but you guys have done a great job. So good job.
So what are some of the testing requirements now? Like, I remember at the beginning, travel was a big factor. I would imagine now with more community spread, travel is not a factor. So what are they asking now?
Well, you're still going to be asked the same questions, maybe not so much about travel, but have you been associated with a known contact? Do you feel ill? Those sorts of things. And so we're dropping some of those barriers. Certainly frontline people, all the healthcare workers and frontline people that need to get back to work. Walmart's going to help us with that. Some of the other testing stations are going to help with that too. And so we just want people to get tested if they've been exposed. If they're sick, please come in and get tested so we can stop this right now.
Okay, and that concludes our news conference for today. Thank you to our panelists and thank you to our media partners for joining us. We'll be back here Thursday morning at 11:30. So in the meantime, have a great week.